the machine learning. What is the machine learning? It is a kind of artificial intelligence, and it is going to allow the system to learn, and also it is going to take out the analysis, and it is going to give the computational result without much involvement of the human interventions. Okay, so here artificial intelligence, just we have to feed the data, and whatever the results that you are expecting, so you just have to click on the icons which are mentioned in the tools that we are going to discuss in the consequent slides. Okay, so we are going to get the required data. And here, what is happening here in the machine learning, what exactly that we have to do is, we have to make the system to learn what exactly that you want. For example, if I would want to know prediction of the myocardial infarction, okay, so what are the factors that would be responsible for causing myocardial infarction, that we have to train the system. Okay, so based on the training, so what the system does, it will understand the pattern of the disease, pattern of the data, then it will be able to analyze our data based on our requirement. So machine learning algorithms have got variety of the functions, which is going to filter the emails, identifying the objects, and even images also. Recently, we are conducting one study. It is the image analysis. That is, it is not only, taking the CT scans or maybe the X-rays. As we are from the medical profession, especially for the nursing profession, we think that it would not be possible for us to do the medical image analysis kind of the studies. It is not at all right. Yes, we can even do the medical image analysis with the simple features. For example, what we have done to understand the like the women, one who has delivered, postnatal women, it is called. I think non-medical people also are here, so that is the reason I'm just defining it. So postnatal women's anxiety levels that we have assessed by reading the images, by reading the faces of the women. So what we have done, we just have taken the images of the postnatal women after the delivery. Okay, so then about 100 women's images we have taken, and we have fed this data in the orange tool, that is nothing but machine learning analysis which can be done, and which I am going to discuss later, right? And it has predicted the woman one who is likely to develop the postnatal depression. Okay, so like a small kind of the studies also can be done, and it will give immense output, and we could publish in very good journal, that is the Q1 journal. So why is machine learning is important for healthcare organizations? Because we have got lot of data in our hospital. Okay, from the time of the patient admissions till the discharge, even the follow-up data also we will be having with us. And if we have to, computize this data manually by human involvement, so it would become very difficult for us. If we have to categorize, or if we have to predict any kind of the disease conditions, or if we have to predict the prognosis of the patient's disease conditions, or maybe if we have to understand which treatment for this particular disease condition is effective, or which treatment is not at all working, right? Or maybe which at the time, like what kind of the interventions really helping us for the diagnosis of the disease condition, or maybe what are the practices which will be helping helping the patients to be satisfied more, right? So this is the kind of the so much data we will be having. But the thing is that we really do not sometimes understand how to do the computational analysis and how to do the this thing publication and all. Okay, so because of the involvement of the machine learning algorithms or maybe the deep learning algorithms, so which is going to help us out to categorize the massive amount of the data, and which is going to give us, which is going to help the healthcare professionals and the researchers for the computational analysis. So how machine learning helps healthcare professionals? Yes, the first thing is improving and predicting diagnosis. Okay, so currently we have done almost 5 papers. We have worked for the prediction of the disease condition of I think recently we have published prediction of the cervical cancer, or prediction of the pregnancy-induced hypertension, prediction of the breast cancer, prediction of the people, sedentary workers who will be prone to have the heart attacks. Okay, so these are the kind of the studies that we are doing. And once you do one study, you will understand and you will get an idea that what kind of the factors that can be involved and that can be used for the data collection. And after the data collection, how we can put this data in the machine, and how the algorithms can be used, and how we can predict the disease condition. Okay, so yeah, machine learning algorithms can be used in the medical imaging, such as X-rays and even MRIs also. That yes. So, however, always we have to remember that though it is going to predict the disease conditions, or maybe the improvement of any kind of the care, or maybe prediction of the prognosis, or maybe prediction of the treatment, we have to train the system. Okay, so after training the system only, so we can feed the data, and based on that, which is going to predict the disease conditions. Okay, so for example, I just have taken an example of prediction of the lung cancer. So we know some of the risk factors, they are responsible for the prediction of the lung cancer. Like if the person one who is having the habit of smoking, or maybe the person one who is working in the industries, and which is going to be prone to develop the lung cancer, or maybe the kind of the living conditions, or maybe the person one who is having the family history of the lung cancer, or maybe if he is having any kind of the medical history, or kind of like tuberculosis if he must be having. These all factors are responsible for causing the lung cancer. Okay, so we cannot say if this person is having, if these factors are associating, and if these risk factors are associated with one particular person, maybe is going to 100%, he may not be developing the lung cancer, but they are the high risk for the development of the lung cancer. Okay, so now what we have to do, and based on these factors, we have to collect the data from people, from whoever is likely to develop the lung cancer. Then again, we have to feed this data. This is a feed in the orange tool, usually, which I am using. Even the Python coding also we can use. Okay, so for the prediction of the disease conditions, and then we can the machine is going to give the wonderful results. Yes, we in previous slide we have discussed that even imaging. Okay, so when we feed the data of images also, the system is able to predict the disease conditions. For example, lung cancer I have taken, and the data will be fed to the system, or maybe training will be given to the system, that if the person one who is having the smoking, or maybe if he is having any kind of the nodules in his in his respiratory tract, and these kind of the people will be prone to develop the lung cancer. So the same kind of the data will be given to the even system also, and this system will be able to develop or maybe predict the disease conditions. So machine learning methods are useful even for the prediction of the treatment also, and even the prognosis also. So as I have mentioned in my previous slides, that we have got a lot of the data in our hospitals. Okay. So, and that too, we have these days, we collect the data in the electronic recording system will be used, and based on that, we will be collecting the data of the patients. So from the time of the admission until the discharge. So it is the complete data of one patient will be included in our electronic recording system. So in which it will be mentioned that with what complaints that the patient came, or maybe what investigations the patient has gone through, or what kind of the treatment was given to the patient, and what was the prognosis. So this is the pattern that you have to feed in the system also. Okay. So when you are feeding, so the system will be able to detect. Yes, for example, if the patient is maybe myocardial infarction and he has been given the ReaPro injections, or say it is because of this injection, there is a lot of prognosis. Okay. So it is going to detect because of these interventions. Okay. So a more number of the patients are getting recovery soon, and yes, it will suggest the healthcare professionals that this continuation of the care will be useful for the prediction of any kind of the treatment, or maybe for suggesting for the continuation of any kind of the treatment. We can see here, I just have taken the stages of the lung cancer here. Again, these are the normal features of the stages of the lung cancer, and this kind of the features will be fed in the computer. Okay, so in the tool, whatever the tool that you are using. So, and at the same time, when you are taking the real data, so the computer will be, the tool will be able to understand the pattern of the disease condition, and it will tell that which stage of the lung cancer it will be able to detect for the so many patients. Okay. Yes, then the treatment of the lung cancer, maybe the kind of the therapies that multiple therapies will be used for treatment of the cancer, maybe surgery, hormonal therapy, bone marrow transplantation, chemotherapy and targeted therapy, radiation therapy and immunotherapy. So this is again, when you are feeding this kind of the data of the patients in the system, so it is able to categorize, and it is able to tell that which kind of the therapy is more effective for the treatment of this particular disease condition, or maybe the multiple therapies are really useful for the detection, or maybe for the treatment of the any kind of lung cancer, which I have taken an example. Even the reducing cost also, right? So in healthcare system, so many interventions we will be doing, or maybe even for the treatment of the patient of any disease condition, maybe we would be trying with so many interventions. Okay, so it is we really do not know which treatment is really working out, right? And which practice is really working out. Okay, so when we have the collective data, when we have the cumulative data, the mission will be able to tell that, so which kind of the practice is more effective, which is going to categorize which kind of the intervention is more efficient, so that it will help the healthcare professionals to follow that particular kind of the practice, so that we will be able to reduce even the cost also. And even the satisfactory survey prediction also can be done. So sometimes what happens, we do many things, but the patients may not get the satisfaction with our practices. Okay, so when we take the survey from the patients, feedback from the patients, and with what intervention, with what practice that the patients are satisfied. So that is also such kind of the activities also this algorithms are going to predict. So improving the care. So as I said, so when the patients are coming with the any kind of the disease conditions, we would be using a number of the interventions and the treatments, or maybe various kind of the interventions will be done on the patient. So based on that, which intervention is becoming more efficient and effective, the algorithms are going to find out, and they will tell the healthcare professionals that yes, this will be more efficient, and it will be you can use this kind of the intervention, so that the recovery rate also will be fast, and even the satisfactory levels also quite high. So we have used some of the factors responsible for the prediction of the cervical cancer. So what we have done in this is our study. So total 17 factors we have taken. So those factors are responsible for causing cervical cancer. So these are only the risk factors. Okay, for example, age. If the age is, the age between 35 to 45 or maybe above, they are responsible, or maybe they are likely to develop cervical cancer. Always, all women are not going to develop, but they are likely to develop. So that factor we have taken. Marital status, the women one who has got married so early, teenage pregnancies, the exposure to the sexual exposure is at a so early stage, and those women also at high risk. And age at marriage, again, so teenage marriages, or maybe age at onset of the sex, if they are so early, if they had exposed, or maybe age at the first child, if they have given birth at a so early age, or lifetime sexual partners, if they would have having more sexual partners, or the lifetime pregnancies, if they are having more number of the pregnancies, or screened for cervical cancer, if they have not at all screened in their lifetime, or number of the times they have screened, or reasons for not screening, smoking consumption. So these kind of the factors that we have taken. Okay, so these are, we know that they are the high risk factors for the development of, or for cervical cancer development. But here what we have done, we have collected the data. Okay, so based on these, using these factors, we have collected the data. Almost 520 women, 501 women, we have collected the data. And at the same time, we have also done the pap smear test, we have done, right? And after pap smear, and we have done the follow-up of it, and how many women have really developed the cervical cancer, and also whether we could do the validation also, whether they are these factors, because these factors are associating for causing the cervical cancer or not. So this is the follow-up kind of the study. For almost 2 years we could do it, and excellent results we have got, and we could publish in one of the very good Q2 journals. So these are the kind of the algorithms we have used, like decision tree, logistic regression, multi-layer perception, Bayes, or the random forest. These kind of the algorithms that we have used, and we could see what is the sensitivity, specificity, and accuracy levels, and even the precision values also. We could do the AUC curve levels also, and we could understand whether they are what is the percentage of their sensitivity for causing for showing the result of development of the cervical cancer. And one more study we have done, again, some of the factors we have taken for the prediction of the PIH, pregnancy-induced hypertension, by using the Justosis score. So here we have got 24 factors we have taken, and each factor was given the score of, first till 11th we have given the score, till 13 we have given the score of 1, and again till 19th factor we have given the score of 2, and till 24 we have given the score of 3 we have given. Okay, so based on this, again, we have done the follow-up of the study, and first trimester we have collected the data, second trimester we have collected the data, and third trimester we have collected the data, until the delivery also we have gathered the data, and we have seen whether the women who had identified at high risk with based on these factors, then we have seen at the end of the, even at the time of the delivery, whether they have really developed PIH or not. So such kind of the validation studies also we have done, and this also we could publish in very, very good journal, Q2 journals we have done it. Okay. So these are some of the studies. Why I am saying, so that you will get an idea how healthcare data can be incorporated and how we can use the machine learning algorithms analysis, and how we can do the this thing for the publication, how it is going to help us out. So coming to the data mining and tools. Okay, so till now, a few of my friends, they are using Python coding for the this thing, but I am not. I usually use the Orange tool. So in this, it is very easy for us, though I am not an engineer and I will not be able to, if there are so much of the software is there, coding is there, and it will be quite tough for me to understand. So that is the reason I have taken the tool of the Orange tool I have taken, and which will be very easy for every one of us to use. Healthcare professional, even doctors and the nurses also, and nursing faculty also, easily they can use this tool. And we have got a lot of material, I can say, in the website available in YouTube also. They every time they keep on updating the kind of the analysis that you will be able to do by using the Orange tool, right? So the same thing I have used, and here I have given the this thing. So this is the link of the Orange tool. And for this, it is not at all requiring any kind of the administrative permissions and all, not required. It is simple to use. At the same time, you don't have to procure, and any there is no fees required for this to procure this tool. Okay, very easily you can use, and take this link and you just so you just have to install it. Okay, once you are taking this, and here download Orange, it is there, and it will be taking, I think, 10-15 minutes time to install. So once it is installed, and it is, this tool will be this already I have kept open. Okay, so this is the tool, how it looks like. So once you open the tool, this is the kind of the screen will be appeared. Okay, directly also you can use. When you are using with the new, you just click on new. Okay, so you will get these kind of the icons. You will be able to see. Okay, so then let us start with the data, how we can do it. So here there is, like, file is there. So that is more important, where you are going to train your data to the system. And here CSV files import also is available. Data sets also available here. For your practice in Orange tool, you will get lot of data sets. And by seeing those data sets, you will be able to learn that how we have to create the table. That is very, very important. In this tool, what I have experienced, that the data preparation of the data table, it plays a very important role, so that you will not come across with any kind of missing data, or maybe you will not come across with any kind of errors you will not experience. Okay, so what you can do for setting, for making the data set, you can use here. There are so many data sets will be there. At the same time, even in this file also, you can find a lot of data sets. Yes. So you just have to click on this file, right? So after clicking on it, you just click on this file for 2 times. Okay. So you will get a lot of already imported data here. If you want to practice, you can have these many tabs are available. Okay, in dataset CSV, or Iris tab is there, or Titanic tab, housing tab. So there are many, even see heart diseases tab is also available. So here the data is already available. So what you can do is just have to click on it and the data will come. So otherwise, if you want to use, so what I would want to suggest you, first you go through that data, okay, and their data sets. And even in the Google also, when you enter data sets for the Orange tool, and you will get lot of data sets, and where you can practice Okay, so tools you can the preparation of the tables you will be able to understand. Okay, so let us see. Here there is Kaggle data sets are there. So when you go to this website also, there are so many data sets are available. Okay, so I have already got the registration. So new users, they have to do the registration. And after the registration, you will get a lot of data sets here. Okay, so here there are so many data sets are there and you can download. Okay, so which will be downloaded in the Z file, and from there you can take, and same thing you can utilize for your practice. Okay, not for your study, for practice you can use. Okay, so for example, here this is the data I have got from that website, and the same data you can use for your, because they have nicely used it, they have nicely formatted. Okay, so when you are trying to collect the data, when you are trying to make the data set, see into that, it will be done in this way. Okay, so normalization of the data is very, very important. So to avoid missing of the data, or maybe to avoid errors, and also see into that if you are using any starting of the capital, see into that the same thing you will be using. If you are using the lowercase letters, then you have to see the same thing you have to use. If you are using kilograms, yes, kilograms for each and every sample you have to use. Or maybe if you are using the pounds, yes, for all the samples you have to use only the pounds. So like that, uniformity you have to maintain for each and every column. Okay, so that accurate data sheet you will be able to prepare. Okay, so this is the data sheet I have got, and this can be used for my practice. And here also on this website also you will be able to get the data sets here, right? And these are the tools you can use for the artificial intelligence analysis. So the tool what I am using, it is the orange tool. Okay, and these are the icons you will be able to see in this tool. Yeah, so what is the orange tool? Orange tool is a competent based data mining software. Okay, so orange tool software can be used for data visualization, what I the tab which I have shown to you. Analysis we can do, we can explore the data, we can do the pre-processing of the data, and modeling of the techniques we can use. So various models that we can use, and where you can do the prediction of any kind of the disease condition, prediction of the prognosis, prediction of the treatment. So these all things can be done by using the modeling techniques. The Orange software is maintained and developed by Bioinformatics Laboratory of the Faculty of Computers, and which is there from the Information Science at University of Zubzana. Okay, so the latest version is here, what I have downloaded. And the Orange is intended both for experienced users, programmers, as well as the students of the data mining. So this is the link I have already shown to you people. It is very user friendly, which I have told you. And we will just go through the slides and we will go for the practice. So what are the various algorithms that we can use? And recently I have used, these are the algorithms like decision tree algorithm, random forest, logistic regression, Navy Bayes, and the multi-layer perception algorithms. And there are so many algorithms are there, and they will be useful for the detection of any kind of the disease condition. So let us go to the, so the first step what we have to do is you have to press on the file. Okay, then you have to click on this file, and you have to click on, as I said, if you want to use the orange already imported data sets are there, that also you can use. Or if you do not want to use them, and if you want to use directly, so you can, yes, you use the data set. For example, I just have made one data set, very simple. So you should see into that it is available in CSV. Okay. So here, for example, we can see here the data set which I have prepared. So name of the samples I just have mentioned. If you do not mention the names also, it is very fine, because always we speak about the confidentiality. So you don't have to mention the names of the samples. You can just put the numbers, right? And here the gender I gave, and the weight of the these people, height of these people, color, and the hair color. If I want to see how the gender is having the impact of all these parameters, so I just have prepared the data set, right? So what we can do is to take this data set in the orange tool. Yeah, let us open the tool. Okay, give right click, then click on this button and take. So this is the data set which is available on desktop. So you can take this, right? And you just import it and close it. Okay. So now what you have to do, you take the data table here. So you can join with this and open it. So the data which you have imported, it has come in this data table. So you can also, like, if you know, if the sometimes whatever the table that you have made in the sequence, it may not come sometimes. Okay. So even here you can do the editing also here. Okay. Based on this tab, with the help of this tab, you can do the editing here. Okay. So you can shift the tables here and there, however you want. You can even edit the table also. Then, yes, you can close it. So if you want to see their data information or anything, these are the tools available. You can see here. So there are so many tools are there, even in visualization also. So you can see if you want to have the scatter plot, or if you want to have the line plot, or if you want to put the bar graphs, or if you want to see diagrams, if you want to put. Okay, there are n number of the innovative graphs are there. Okay, so even in Excel also you will get the graphs. However, but these graphs are, it will look very professional. Okay, so what you can do is you can take, yeah. So this is the scatter plot I have taken. I just have to join here, and it is going to scatter the data here. Okay, so as I have got the very less data, so that is the reason which is not very much effectively it is showing. Okay, or maybe you can also take the bar graph also, you can join here. Okay, so this is the way how it is the distribution of the graph will be shown, or maybe you can use these kind of the plots also. You just have to join, and the data is going to be connected with this tool, and it is going to give these kind of the graphs. Okay, and even you can add the color painting also can be done. So there are the tools available. So for if you want to make these graphs are very very effectively shown, so you can make the painting also. Okay, and yes, and there are models like you can see here. So these are the models usually we use for the prediction models are there. Okay, so here neural network is there, random forest is there, gradient boosting is there, SVM model is there, linear regression is there. But how these models can be used, and we have to, what we have to do is, first we have to train the system. Okay, so for example, I have got the data of, for example, I have got the data of, yeah, this is the data I have got. Okay. So this data around 501 sample sizes there. And this data, what I can do is normal values of that particular disease condition can be given to the system, or what we can do is 50% or 40%, 60%, 80% of the data of this can be split into two parts. Okay, so 80%, for example, if I want to take, there is no as such kind of the rule that you have to take only 70%, you have to take, but how we have to see into that above 80% of the any kind of the data that you can split into two parts, and that 80% of the data that you can feed into the system, train into the system. Okay, so remaining part you can go for the feeding of the data, which is going to do the analysis and where you are going to apply the predictive models. Okay. Yes, we can even use if the predictive models to be more effective, if the predictive models to be more efficient results, if you want to get, always you should see into that large data you have to train the system. Okay. So then you will get the efficient result. Yeah. So we can close it. Then again, we can even descriptive statistics also very nicely we can get from here. Feature statistics. Okay. When you are seeing and you just have to join, then you will get all the descriptive statistics. Okay, mean, mode, median, dispersion, you will get. And what is the missing data that that will tell us. Okay. So these kind of the descriptive data and even graphs also you will get. Okay, so only the thing is that this is about the tool. With the tool, you can do lot of miracles we can do actually. Okay. So have to be validated by experts. Okay. For example, if I would have taken the risk factors for the prediction of pregnancy-induced hypertension, what I have done, I have validated with the Gestosis Society and even the Foxy Society also. Okay. So they have validated so that tomorrow we will not face any kind of ethical issues. Because these days, if you would have to approach any Q1 or Q2 journals, definitely they would be asking the ethical committee approval they will be asking. Okay. So in such cases, even when you are approaching the ethics committee, so they will ask how this score, whatever the factors that you are using, how you have got validated. Okay. So it needs to be endorsed by some experts. Okay. So if you are getting endorsement from some committees or maybe some societies, like Foxy, or maybe even in Pune, Obstetrics and Gynecological Society also is there. And from there also I get, and even we get approval from Fetal Medicine Society also, even from the Gestosis Society also, once they give the endorsement, because a lot of critical evaluation is required when you are saying that this factor is responsible for causing any kind of the disease condition. So we have to we have to do a lot of validation, and we have to take the opinion from the experts. So this is my suggestion. So but you can do a lot of studies, you can do so many studies you can do. Even you can do some kind of the therapies also. So what I do here in Symbiosis, I collect the data from the patients, this validation of the factors and getting of the approval from the ethics committee. Then after that, collecting of the data from the patient, up of the patients, if it is again depending upon the study, kind of the study I am doing. So after collecting all these things, I just give the objectives, and then I engineering people. Okay, so we have got the engineering institute here. SIT, it is called Symbiosis Institute of the Technology, and especially those who are working with the artificial intelligence. So I approach them, I just give the data to them, and even they do the normalization of the data and setting of the data set, how they have to make according to their tool requirement, they do it. And finally, they give the results to me. Then based on the results, then I write the paper. Okay. So this is the way we do this thing. When we do these kind of the studies, what is the main advantage here? You can approach many journals, even engineering journals also. There are so many journals are there. Bioengineering journals, many are there. Okay. And even artificial intelligence, like the Journal of Artificial Intelligence, many journals are there. We can approach them. Okay. Otherwise, if we are doing only in the medical profession, what would it happen? We have got the limited journals, and also even a lot of review process is also too high, and it takes really lot of time to publish, especially in Q1, Q2, it really takes time. Okay. So to avoid such kind of things, I think I have started using of this to now quicken the process of publication these days, because of this is the process what I am using right now. Okay. So I think so I can suggest my nursing faculty members to start this kind of the process, so that you can fasten your publications, because many times it is of my junior faculty, they say that, ma'am, we do a lot of work and we did the data collection very accurately, We have written the paper also, but finally the journal is not getting accepted. So until unless you have the innovation in your paper, and otherwise, then only you can expect that yes, your publication